Hello, class. This is Randy Gaines. This is our third question for this semester. I will be using the text for reference, the LAM text, care coordination, the game changer, how nursing is revolutionizing quality care. And then my article that I used was patient engagement and research, a systemic review. Um, So my project, since we all had the question, I'm sorry, go back to that. Identify one topic that interests you from the three sections. The section or the subject I used was quality and safety outcomes for patients and their families. And that goes with the implementing for my project. You don't know my project yet? I'm about to tell you. So for my project, I chose to use a community. I'm gonna identify. My project will reflect the need for programming regarding sexual health, positive body image, and starting uncomfortable conversations with teenagers. So in doing so, the big part of my project was the not so much coming up with the project, but how to implement the project and keep going probably past this actual project because it's gonna be in a community. It's actually in my neighborhood, so we're gonna see if we'll keep the project going even after this project for this class is done. Um, so I did quality and safety outcome for patients and families because we've done a lot of researching, but the implementation part and the buy-in from the community is usually what's lacking. Um, the text talked about how to do it. One of them was they used a guided care model led by Dr. Chad Bolt. And in the model, they assess patient needs and preferences, create an evidence based care guide, monitor the patient proactively, supporting chronic disease self management, educating and supporting caregivers, communicating with all external care and service providers, facilitating smooth transition between sites of care, and last, facilitating access to community services. So, of course, my project won't be that big, but the implementation and how to guide it and streamline it, be it the questions that I have to add, developing the questionnaires. I have a group of friends and colleagues that I'm getting together or got together with to come up with questionnaires and for the kids to actually tell us how they want to address certain issues that are important to them. A lot of times as adults, we attempt to tell them what we feel and we project on them what we want them to know. Well, that's why they don't want to do anything we tell them to do because they think what we're talking about is stupid usually. So we're going to give the kids a chance to tell us how they would like to learn. And then we're going to take that and we're going to develop it. And we're going to teach them according to their own learning styles. Give it a try. So, the article that I read also ties into the implementation. It was an article that I found in, second, go back to this, that was in the NCBI resources. And so it was a patient engagement and research and systematic review. So that article, in short, is talking about implementation and how we need to get patient. I'll just read it. A compelling ethical rationale supports patient engagement in healthcare research. It also assumed that patient engagement will lead to research findings that are more pertinent to patients' concerns and dilemma. However, it is unclear as to how best to conduct this process. In this systemic review, we aim to answer four questions. What are the best ways to identify patient representatives? How to engage them in designing and conducting research? What are the observed benefits of patient engagement? And what are the harms and barriers of patient engagement? Well, I already answered some of that. If we can't get them to buy in, they won't participate. If they don't participate, we're not investigating anything because we're not going to have the data because we're not going to have anything to measure. So, what did we learn today? We have to learn how to implement, and we have to learn how to engage the people that we want to implement stuff with. If we do not get them to engage, we can't come up with data to implement, and then we have a dead study. That is mine for tonight. Thank you.